So the next slide is we call our funnel report. Actually, its title is the Condition Management Summary, but we like to call this the funnel report for reasons that I hope are obvious. And basically what this does is it outlines how we identified people in your population who might benefit from our various wellness and care management programs, care improvement programs, and then how many folks we reached out to and how many folks got involved in the different programs that are available. So across the top of the funnel, we list the people who were identified, the number of people who were identified by different kinds of identification process. And so there were 58 people, starting on the right, there were 58 people who were identified through what we call referrals or triggers. And this would be either somebody who was hospitalized, and so we learned about their health issue that way, or that we received a prior authorization request. That's another kind of trigger that we identify. Or somebody who was referred. So we have people that are referred by their doctors, who are referred by member services, nurse navigators, or who just self-refer to one of our programs. And so we had a fair number of folks being identified that way. The next two categories are all identified by claims. So we analyze the claims in two different ways. We use a software tool to analyze people. That's a kind of a predictive model that predicts who might be at risk for being hospitalized in the next year or so. And those high-risk people that we reach out to engage in case management to try to prevent hospitalizations and make sure they're getting all the care they need as outpatients. And then the targeted conditions group are the folks who are identified as having one of the chronic illnesses that we offer disease management programs for, and we try to reach out to them and get them engaged with those programs to make sure they're getting all the care they need and managing those conditions properly so they don't get worse over time. And then lastly, there was one person we identified through our health assessment as having one of those risk factors we talked about, and then we reached out to them as well. So of the 267 unique members that we identified, we reached out to 264 of them, which is about 16% of your population. Occasionally we don't, we'll find somebody at risk, but they've already left the plan, or there's some other reason why it doesn't make sense for us to reach out to them, but we reach out to most people. And of that 264, we were able to engage 150 of them, or a little less than 60%, in one or more of the programs that are listed at the bottom. Now, not everybody, we don't actually try to actively engage everybody. There's a segment of the population, those who have asthma or chronic obstructive lung disease or depression, where we have reason to believe that they either have a relatively mild condition or we can tell from their claims data that they're pretty well managed. And we let them know about the program and invite them to participate, but we don't do a lot of outreach, mailing, and phone calls to them because we don't think that there's necessarily going to be as big an opportunity to improve their health or lower their costs as there is with some of the other folks. And we want to keep our operational costs reasonable. So, but we actually do get a fair number of people volunteering for those programs once we mail them. So our participation rates in the asthma program and the COPD program in particular are often over 100%. And you can see the biggest programs here were the asthma and the diabetes programs, the inpatient case management program, and then we had a fair number of folks in depression, specialty pharmacy, and heart disease.